If you've ever heard debates, arguments, or confusion surrounding squirting, you're not alone. It's one of the most misunderstood topics in sexual health, and yet millions of people are curious about what it really is. Today, I'm Dr. Jessica Morgan, and in this video we're taking a calm, science-based look at what squirting actually involves, what the body is doing, and what modern research has revealed. If you've ever wondered where the fluid comes from, how the process works, or whether it's normal, stay with me, because by the end of this video, you'll understand the truth in a way that's respectful, medically accurate, and grounded in real physiology. Before we begin, I want you to take a breath and relax. This topic tends to make people nervous, mostly because myths and misinformation have overshadowed the real facts for decades. But sexual health is human health, and understanding the body is never something to be embarrassed about. My goal today is to give you clear, reliable information that helps you understand what actually happens during arousal and orgasm in individuals with female anatomy. Let's start with the basics. Squirting refers to the release of a clear, often odorless fluid through the urethral opening, the same place urine exits the body. But this doesn't automatically mean the fluid is urine. To understand this better, we need to look at the anatomy. Just beneath the urethra are structures called Skene's glands, sometimes referred to as the female prostate. These glands develop from the same embryological tissues as the male prostate, which means they can produce some of the same components, including trace amounts of PSA, prostate-specific antigen. Research has shown that during sexual stimulation, particularly when the clitoris and surrounding tissues become engorged with blood, pressure builds in the pelvic region. This can cause small amounts of fluid from the Skene's glands to be released. This fluid is different from natural lubrication and also different from female ejaculation, which tends to be thicker and produced in much smaller quantities. Squirting typically involves a larger volume of fluid, sometimes enough to surprise people, and that's part of what raises so many questions. So, where does this larger volume come from? Scientific studies, including ultrasound imaging before and after sexual activity, suggest that part of the fluid does originate from the bladder. But that still doesn't mean squirting is simply urination. Chemical analysis shows the fluid is often much more diluted, with lower levels of urea and other waste components compared to typical urine. In other words, the bladder contributes fluid, but the composition is noticeably different. Some researchers think internal pressure changes, hormonal responses during arousal, or even muscle contractions may temporarily alter the bladder's filtration process. Others believe that Skene's gland stimulation triggers a reflexive release of fluid stored near the urethra. In smaller experimental studies, markers added to the bladder confirmed that some of the released fluid does pass through it. But even then, the fluid remained significantly more diluted than normal urine. There are also reports from individuals who take medications that color their urine, yet their squirting fluid remains clear. This tells us that the process is more complex than a simple definition. The bottom line is this: squirting is a real physiological response that some individuals experience and some do not. It can involve a combination of fluids from the bladder and from the Skene's glands, but the result is distinct from normal urination. More importantly, it is not harmful, not a sign of a medical problem, and not something anyone should feel ashamed or pressured about. Every body is different. Some people squirt, some don't, and both are completely normal. The goal here is understanding, not comparison. Sexual responses vary widely from person to person, and healthy intimacy is never about meeting expectations set by media or myths. What matters most is communication, comfort, consent, and emotional connection, not whether someone experiences a specific type of fluid release. So whether you're here out of curiosity, confusion, or simply wanting to understand the human body better, I hope this breakdown helped you see that squirting is a natural variation of sexual physiology. If you'd like to learn more about how people feel about their own experiences with squirting, or explore more sexual health topics backed by science, make sure to check out the other educational videos on this channel. And remember, the more you understand your body, the more empowered you are to take care of it, because you are absolutely worth it.